Welcome subscribers and new viewers. This is going to be a presentation on the autonomic nervous system, specifically the autonomic receptors, because I am a pharmacologist and I like to talk about the physiology, but also what would happen if a medication would interact with these receptors. So we're going to start off pretty simple here with just the pupil. What causes it to constrict? What causes it to dilate? First of all, pupillary constriction is determined by the parasympathetic nervous system, specifically M3. That muscarinic receptor causes pinpoint pupils or constriction. Many medications can do that as well, which we won't get into here. On the other hand, if we dilate it, that's caused by the alpha-1 receptor, which is the sympathetic nervous system. So you see that patients that are exposed to stimulants or the fight or flight response will have dilated pupils. I'm going to try to put this in the physiological context or the purpose of these things if they had a purpose. So why would we dilate the pupil during fight or flight? And that would be to allow more light to enter the retina, so we could see more of the threats that we're having, the threat or threats, so we can more easily escape that threat or fight with more visual acuity. Okay, so the next function we're going to talk about is sweating. So this is really in no particular order, but we're just going to go around in a clockwise direction and cover all the different major organs and tissues. So the sweat glands are interesting because they're activated by both alpha-1 and M3. Alpha-1, of course, as we already discussed, that's adrenergic. So that's activated by epinephrine and norepinephrine. M3 is cholinergic, so that's activated by acetylcholine. So this may lead you to think that this is a dual innervation by parasympathetic and sympathetic. However, that's actually wrong. This is an exception to the majority of the other organs, right? This one's different, or this tissue is different, because adrenergic and muscarinic receptors are both considered part of the SNS response in sweat glands. So it's very, very easy to forget that the M3 receptor in this specific tissue is not considered parasympathetic. So we have a combination of adrenergic and cholinergic, both promoting sweat. Okay, so in case I didn't say that earlier, this is assuming when these receptors are activated. So when these receptors are activated, this is what's going to happen. Okay, so more secretion in both cases there. So the next function is going to be tear formation. So that would be in the lacrimal glands. That is primarily mediated by M1. So that's muscarinic receptor type 1 in the lacrimal glands. Okay, so that's primarily a parasympathetic activity there. The next region of the body that we're going to talk about is the nasopharynx. The nasopharynx happens to be where you're essentially where the nasal cavities are, and then it goes all the way down where the throat begins. Okay, so the nasopharynx is controlled primarily by the parasympathetic nervous system. That would be muscarinic receptors M1 and M3, and they promote secretion. Okay, so you can have runny nose, and then kind of secretion throughout the pulmonary system. Really, we're talking nasopharynx, so produced up in the kind of in the mouth, in the pharynx, but then potentially dripping down into the respiratory system as well, or swallowed into the GI tract. But the main point is that we have enhanced secretion here. Okay, M1 and M3 enhanced secretion. Next is the salivary glands. Okay, the salivary glands are activated by alpha-1. This is kind of a strange one. If you kind of look it up anywhere, you'll see that alpha-1 adrenergic receptors, when they're activated, they produce a slight secretion of thick mucus, which is different in characteristics to the M1 and M3 promoted secretion, which gives you your normal salivary secretion. So M1 and M3 again are just like all the other muscarinic receptors, are activated by acetylcholine. So alpha-1 primarily, again, epinephrine and norepinephrine. So this could start, we could basically start to discuss the function and the purpose of this, and that would be to produce more saliva during, if you have a meal, right? Your taste receptors are telling your brain there's food here, so we need to produce more saliva to lubricate that and to help start to break that down. Okay, so that's why your parasympathetic nervous system is very pro-digestive function. So next we're going to talk about blood vessels, that would be arteries and veins, and specifically whether or not we have vasoconstriction or vasodilation. Constriction is, of course, when the blood vessels get smaller, and dilation is when they get larger. This is actually a little bit more complicated than what I'm going to present here. Some tissues will have constriction by the sympathetic nervous system, and some tissues will have dilation by the sympathetic nervous system, depending on the function of that tissue. So we have, first of all, we have the beta-2 receptors. The main function of beta-2 receptors in the blood vessels when they're activated is to cause vasodilation. Okay. So the next receptor type is the alpha-1 receptor. This is our pure vasoconstricting receptor, as you'll see here now. That causes constriction of arteries, specifically actually arterioles, which are smaller, and then veins. So you might be wondering, if both of these receptors are activated by the sympathetic nervous system, how does the body determine whether or not we have a net dilation or net constriction in a specific arteriole? And that is determined partly by what, how many beta-2 receptors are available, how many alpha-1 receptors are available there on that vascular smooth muscle, and what is the concentration of epinephrine. Because epinephrine can activate both of these, whereas norepinephrine can only activate alpha-1 receptors. So that means the major catecholamine, which is what norepi and epi are, those are catecholamines. The major one that determines the, whether or not we're going to get dilation or constriction would be epinephrine. So if we have a really kind of high level of epinephrine, that can result in some vasoconstriction. If we have a low level, it's mostly vasodilation. If you're running, you need your skeletal muscles to get blood supply, so we'll mostly have vasodilation through beta-2 activation by epinephrine, whereas the kidneys will have lower blood supply, and that will be primarily through alpha-1. So it's a complicated scenario, and we'll get into this a little bit more later. And then finally, you might be asking at this point, what about the parasympathetic nervous system? What about muscarinic receptors here? The truth is, the parasympathetic nervous system mostly innervates blood vessels in salivary glands, gastrointestinal glands, and genital tissue. So we have very little role of the parasympathetic nervous system in mediating blood vessel diameter for the majority of the body. Okay, so the PSNS is not used really to regulate that resistance to blood flow there. It is used to regulate the heart, which we will talk about in a little bit. The next organ we're going to talk about is the stomach, specifically the gastric parietal and mucosal cells. The parietal cells are what make the acid, and the mucosal cells make mucus and bicarbonate to protect our own stomach cells. So I'm going to look at this from the context of if you had swallowed some pathogens or microbes. Really, we know that the acid here is at least as important for preventing infection as it is for digesting food. Okay, so what we have is the M3 receptors are going to promote mucus, bicarbonate, and acid secretion. That acid will help to destroy these pathogens that we just saw there. Okay, and that's, again, specifically just M3. So that is mediated by the parasympathetic nervous system. The next organ we're going to talk about is the intestines, specifically the smooth muscle and secretion of fluid there. Now there are a lot of receptors we're going to talk about. We're going to go through them quite rapidly in the animation, and then I'll spend a little bit of time actually talking about each one. So in general, though, we have parasympathetic activity, which stimulates peristalsis, or movement of the intestinal muscle to move the digesting food forward. We have also the parasympathetic nervous system stimulating secretions here. So PSNS is very pro-digestive activity, bowel motility, all those things. The sympathetic is generally inhibiting these things. So you'll see this in this fairly quick series of animations. So M3 peristalsis, okay, M3 sphincter relaxation here, M1 secretion, alpha 1 sphincter constriction, and that's the anal sphincter, the internal anal sphincter specifically there. And I have two more that I'm going to pop up here on the side, but let's talk about what we had so far. So far we had M3 causing more motility, M1 causing more secretion, M3 causing a relaxation of the internal anal sphincter, which is really important for that. So when that relaxes, that allows us to have a bowel movement. Okay, so whereas most of the muscle is moving and contracting, the sphincter muscle has to relax to allow food to, well, actually chyme, which has been dried out, formed into fecal matter, and that allows that to pass as the stool. Alpha 1 does the opposite here. That's going to cause sphincter constriction. So if you have sympathetic nervous system activity, that is going to prevent a bowel movement by constricting that, again, internal anal sphincter there. So that, hopefully that makes sense that, when you're physically active, so if you have a lot of adrenaline, or the fight or flight response, that is going to limit your bowel activity. Specifically, what I've shown so far is limiting the sphincter opening, so it'll constrict that. But then we also have alpha 2 receptors limiting secretion, and then alpha 2 receptors limiting peristalsis. So what we have is a balance here. So if you have pro-parasympathetic activity, you have pro-bowel motility, pro-bowel secretions, pro-digestion. If you have more sympathetic activity, you have less bowel motility, less secretions, more sphincter constriction to prevent a bowel movement. So yeah, it's pretty much black and white. If you have, if you are relaxed, you don't have a lot of sympathetic nervous system activity, you have food that's ready to be passed, it's already digested, already formed fecal matter, it's ready to be passed, you'll have more parasympathetic activity there. Next, we're going to talk about the bladder first, the trigon and sphincter. The trigon is this little triangular structure here, and then we have an actual sphincter muscle down here in the bladder. I don't have any animations for this, but we'll go through this pretty quickly. So M3 causes relaxation of the trigon and sphincter. That allows us to urinate. Okay, alpha 1 causes contraction or constriction. That reduces urination. So that is basically kind of at the bottom of the bladder here. We have this trigon muscle, and then again, and then the sphincter muscle. When that all constricts, even if the bladder has urine in it, that will prevent urination. So that would be, again, the sympathetic nervous system. So hopefully this is starting to make sense that when we're having a lot of adrenaline in our system, we don't want to be urinating, we don't want to be defecating, right, or digesting food, because I guess the theory would be that, we had evolved so that when the sympathetic nervous system is activated, that's probably because we're escaping from something that's a threat, or we're fighting something. So the body tries to limit energy use in the non-essential organs for that fight or that escape. Okay, so that would be sympathetic. So again, parasympathetic is pro-urination. It's also, as we talked already, pro-defecation, pro-lacrimation. And what are we missing? So that's typically called SLUD. So salivation, lacrimation, urination, and defecation. SLUD or SLUD that is what generally pro-parasympathetic activity would do. Next is the detrusor muscle, which is also part of the bladder. Now you can imagine so if that constricts, that will force urine out of the bladder. So again, going along with the same trend, that if the parasympathetic nervous system is hyperactive, that would promote urination. That would be M3 that would contract that. Beta 2 would relax that. So even though it looks really complicated sometimes, things kind of work together as a team. These receptors kind of work together as a team. So sympathetic is in general just trying to prevent urination and all these other things we talked about. So again, digestion, urination, things that are not essential for survival during a fight or flight response. So beta 2 receptors, by relaxing that detrusor muscle, you don't squeeze it, so you allow the urine to sit in there rather than urinating, so that decreases urination. Okay, so the really helpful generalization here is that beta 2 receptors on any smooth muscle we're talking about, when we activate beta 2 receptors, that causes relaxation. So that would be blood vessels, the bladder, that would also be in the lungs, and we're going to get to that pretty soon. Next is the renal afferent arterioles. You may be wondering what that means. And for a lot of people, the renal anatomy and physiology is the most complicated. And my personal opinion is that part of that is because more time is usually spent in class on the cardiovascular system and the nervous system. But really, it should not be super complicated. And I'll tell you exactly what I'm talking about here. So first of all, beta 1 receptors, which are normally thought of as cardiac receptors because those are the major receptors in the heart, in the sympathetic nervous system. But beta 1 receptors are also right here this is called the afferent arteriole of the nephron, and this is the beginning of a nephron, and this is the microscopic tubule that is in, there's about 1 million of them in each kidney, and it has this micro blood supply called the afferent arteriole. And then as that courses through there or percolates through there, things that don't get filtered into the urine will continue, and that's the efferent arteriole. And there are these specialized cells called granular juxtaglomerular cells that release this enzyme called renin. When renin is released, it travels throughout the whole body. So this will continue. Okay, this blood flow will continue until we get to major veins, and then we get to the heart, and then coursing throughout the whole body will be the renin. And ultimately what that results in is production of this peptide called angiotensin 2, and then release of aldosterone. Those cause vasoconstriction, particularly the angiotensin 2 causes vasoconstriction. Aldosterone causes sodium and fluid retention in the kidney. So ultimately what we have is that beta 1 mediated renin release is going to increase our blood pressure due to, again, constriction and fluid retention. Okay, so that is what generally the sympathetic nervous system seems to be pro higher blood pressure and higher, higher capillary filtration in all of your tissues during that, again, that's that high adrenergic response. And the alpha 1 receptors cause vasoconstriction. Okay, so that would limit the renal blood flow into each glomerulus. Again, this is the glomerulus here. So by that vasoconstriction there, we are preventing a lot of our cardiac output from going to the kidney during the fight or flight response, when we don't want a lot of cardiac output to the kidneys. We want it to the heart. We want it to the skeletal muscle. Of course, the brain always gets a high blood supply. That brings us to the cardiac muscle tissue. We have beta 1 receptors on the heart that have a major role here. So first is inotropy. Inotropy is the force of contraction, which is increased by activation of beta 1 receptors. I'm only showing these kind of lines going to the left atrium and the right ventricle, but the reality is the whole cardiac muscle tissue, both atria, both ventricles, are activated by beta-1 receptors to increase the force of contraction. So what I'm showing you here is kind of a squeezing action, which is supposed to represent force of contraction, like I said. Okay, that's just the beginning though. Beta-1 receptors are also involved in the rate of the heart. Okay, so we're moving on to nodal tissue. And nodal tissue is specialized cardiac tissue, which is not neurons, but it is cardiac tissue that has got a very, very important role in conduction, in initiating the automatic action potential for that heart to beat. So we have a node here called the SA node. We have one here called the AV node, so that's sinoatrial, and then atrioventricular nodes. The SA node normally dominates the rate and rhythm, so that would fire action potentials automatically, even without input from the central nervous system. Okay, the central nervous system can regulate that, but it does fire on its own at a regular rhythm here. Beta-1 activation increases the rate, okay, through increased SA nodal activity, and also conduction through the nodal tissue. So not only does the rate increase, but conduction from atria through the nodal tissue, then into the ventricles, that is sped up. So we have a faster communication between the atria and the ventricles, and that's all electrical activity there. So I'm showing you that speeding up. However, if we had extra muscarinic activity, okay, specifically M2, that would do the opposite. So that would lower the rate of conduction and the rate of impulse generation and the conduction. So that slowed down the heart. So as you could probably guess, then if someone had a lot of adrenaline, of course, their heart speeds up and it beats stronger because of beta-1. If someone had a lot of parasympathetic activity, that would lower the rate and slow down AV conduction due to that M2 receptor. So that would be a weird example, I guess, would be like if someone is going number 2, or in the bathroom, and they have to have a bowel movement for some period of time. That activity will cause your heart rate to slow down, primarily due to the parasympathetic nervous system is very important in bowel activity. So you would actually slow down your heart rate temporarily through the vagus nerve. But there are many medications that can do that as well. Really, all the receptors we talked about can be affected by medications or toxins. The next organ we're going to talk about would be the lungs. Okay, that would be the bronchial or smooth muscle and glands. So the bronchioles, if you're not familiar, are the kind of the tributaries where the air flows deep into the lungs. Okay, so that's after the trachea or the windpipe. Those bronchioles have muscle in them, so they're somewhat flexible, and one of the most important functions there is that for that muscle to dilate or relax when we need to get more oxygen in and CO2 out. And then we have glands in there for secreting fluid or mucus. So first of all, beta-2 causes relaxation of bronchioles. So that is sympathetic. So that would hopefully make sense to you, that so if you're having that fight or flight response, or if you're just simply doing a marathon, doing a sprint, your adrenaline or epinephrine would be released into the blood, and that would activate beta-2 to cause pulmonary bronchiolar dilation to get more oxygen in there while you're exercising. Okay, so that hopefully makes a lot of sense. And then we have the M3 muscarinic receptors, which cause contraction and secretion. So the parasympathetic nervous system is not, I don't want to say that it's preventing us from breathing well, but that's generally what's active when we're at rest. The lungs are they're not very dilated, those bronchioles. So until we get sympathetic activity, they're kind of at a resting state. Now, it is true that if you had excess acetylcholine or excess parasympathetic activity, that would cause too much bronchoconstriction and some secretion there, which will cause trouble breathing, absolutely. And that's That's what they use. Sometimes for a pulmonary sensitivity test, they do use cholinergic agonists, they're activators. Next, we have the skeletal muscle. The only reason why I'm talking about skeletal muscle is because I wanted to point out that this is not the autonomic nervous system. This is actually the somatic nervous system. I did want to mention that it is controlled by nicotinic receptors, which, when they're activated, they promote skeletal muscle contraction. Okay, that is often used therapeutically by, often we'll see blockade or blockage of nicotinic receptors to promote skeletal muscle relaxation to allow a surgeon to perform a surgical procedure. So a lot of times when we do the neuromuscular block, we might they might block the nicotinic receptors in order to, again, allow that muscle to just stay relaxed. However, this is a good segue into the fact that, right, the nicotinic receptors are also in the central nervous system and in the autonomic ganglia. So, you know, anyone who's ever tried nicotine would probably realize it does affect mood. It can affect your heart rate and a lot of other things, and that's because nicotinic receptors are activated by nicotine, and those receptors are available in these autonomic ganglia, that's the connections between the neurons coming out of the spinal cord and then the neurons that are then traveling to the final organs. That ganglia will be in between there. So nicotinic receptors there can promote, if you're activating them, that can promote that neuron firing, or if you inhibit them, that can reduce neuron firing. So that's why nicotine could affect mood, cognition, sympathetic activity, and parasympathetic activity, because those ganglia are in both arms of the autonomic nervous system. So nicotinic activation is a lot more complicated than some of these other receptors that we talked about. But I just wanted at least to introduce that point, that in case you were wondering, well, we talked about muscarinic, we talked about adrenergic, what about nicotinic cholinergic, and that's where this is going to be involved. Finally, we have the piloerector muscles, which are involved in hair raising, and that is controlled by the alpha-1 adrenergic receptors. So when we have the sympathetic nervous system being activated, we do have hair raising there. Now we're going to move on to a summary of each arm of the autonomic nervous system, with more of a focus on the purpose of these things. Why do these, or how do these help our body? And then that'll wrap up the presentation. So first, a summary of the sympathetic nervous system. In general, the sympathetic nervous system is pro-increase in blood pressure and blood flow to specific organs. So generally, it raises blood pressure. It causes cardiostimulation. It actually increases the rate of the heart. So that would be through beta-1 receptors, and the force of contraction also through beta-1 receptors. So that's chronotropy and inotropy. The sympathetic nervous system can cause vasoconstriction in certain arterial beds. That would be things like the kidney, so renal afferent arterioles, and some other ones. So that's an increase in arterial resistance, meaning a decrease in renal blood flow. Vasodilation in skeletal muscle arterioles to enhance blood flow and oxygen delivery during exercise. Some vasodilation in the skin to cause dermal heat dissipation through that excess thermogenesis during exercise. Pro-renin release that increases arterial resistance through angiotensin II and increases sodium and water retention through angiotensin II and aldosterone-mediated sodium and water retention. The sympathetic nervous system causes bronchial or smooth muscle relaxation, so increased pulmonary function through beta-2 receptor activation. Enhanced vision through mydriasis, or dilating the pupils. That's through the alpha-1 receptors, and that, rather than just really saying enhanced vision, it is enhanced entry of light into the retina to allow you to kind of perceive your surroundings better. Enhanced sweating increases evaporative cooling. Remember, that's the strange one that is sympathetic, but it is both the adrenergic and cholinergic system, both considered sympathetic in that rare case. Less energy use in the GI tract, less bowel motility, less bowel secretions to preserve energy for our survival functions in the fight or flight response, less urinary activity, so less bladder constriction, less glomerular filtration, and thus urine production. And that is directly tied to this decrease in renal blood flow through the constriction of renal afferent arterioles that directly lowers filtration and urine production. So that's all connected. Finally, the parasympathetic nervous system summary. The PSNS lowers blood pressure, mostly through a decreased chronotropy. It does not have a profound effect on the force of contraction or inotropy. So again, it's mostly innervating the nodal tissue in the heart. Non-enhanced pulmonary function. What I mean by that is we don't have a dilation of the bronchioles at rest. We don't necessarily have restricted breathing unless we have excess stimulation of the parasympathetic nervous system. Typically that would be through chemical means, right? If someone were exposed to too much of a cholinergic agonist, or if someone had an inhibition of their acetylcholinesterase enzyme that breaks down acetylcholine. Non-enhanced vision, so meiosis, meaning you don't have that dilation, so you don't have extra light entering because you don't need it. You could even have meiosis if you have too much parasympathetic activity. Increased GI and mucosal activity for digestion, more salivation, more nasopharyngeal secretions, more bowel motility, more bowel fluid secretion, increased gastric acid secretion. This is all pro-digestion. Okay. Increased urinary activity, more that detrusor contraction or bladder contraction, increased sphincter relaxation to allow the urine to get out, and then maintenance of normal renal blood flow. So we're not constricting afferent arterioles if we have low sympathetic, right? So it's not that the parasympathetic is necessarily promoting dilation of the afferent arterioles. It's that lack of sympathetic is allowing the dilation to persist, to have good urine production. Pro-tear formation or lacrimation. This wraps up the presentation on the autonomic nervous system. Thank you so much for listening, and I hope you have a great day.